Heart fitness test at home. How to check if your heart is okay at home. Heart disease is the leading cause of death worldwide. Check out these 12 simple tests to assess your heart health at home and decide if a doctor's visit is necessary. Toe touch test, sit and reach toes test. Try the sit and reach toes test by sitting on the floor with your legs extended and attempting to touch your feet. This test not only measures your flexibility but also offers valuable insights into your heart health. Stiff arteries associated with a higher risk of heart attack and stroke are often found in inflexible bodies, particularly in individuals over 40. If you can't touch your toes, it may be a sign to check your blood pressure, as your heart may be working harder to pump blood through inflexible vessels. Tap foot to pulse. To find out if there's an issue with your heart rhythm, try this simple test. Place a finger on your wrist or neck to locate your pulse and tap your foot to the beat for a minute. If you find it difficult to tap along easily in time, and your pulse is very irregular, this could be a warning sign for atrial fibrillation or stroke. The test can easily highlight extreme irregularities, fluttering, or palpitations, which you should discuss with your GP. Body mass index. According to the research, every 5-point BMI increase is associated with a 32% increase in the risk of heart failure. By figuring out your waist-to-height ratio, you may check your body mass index, BMI, which should be between 18.5 and 24.9. The BMI is computed by dividing the weight in kilograms by the square of the height in meters. In English measurements, it is pounds divided by inches squared, multiplied by 703. Waist size. The majority of us do not have the same waist size as we were in our 20s. The midsection size can reveal important details about our health. Even if you are still a healthy weight, having a larger waist still increases your risk of health issues. A larger waist circumference indicates greater visceral belly fat, which increases the chances of type 2 diabetes, high blood pressure, high cholesterol, and heart disease. A low-risk waist measurement is defined as one that is less than 31.5 inches for women, and less than 37 inches for men. In women, 31.5 to 34.6 inches is high risk, and more than 34.6 inches is very high risk. In men, 37 to 40 inches is high risk, and more than 40 inches is very high risk. This is how to take a proper waist measurement. Look for the top of your hips and the base of your rib cage. Take a tape measure and place it around your midsection, halfway between them, just above the belly button. Make sure it is tightly pulled but not so tight that it digs into your flesh. Take your measurement after a full, normal exhalation. Take another measurement, simply to be sure. Waist-to-hip ratio, WHR. The waist-to-hip ratio may be a more accurate predictor of heart attack risk for both men and women, in comparison to the body mass index. The ratio of waist to hip size is a more accurate gauge of obesity as it measures visceral fat, fat around the organs, and gluteal muscle mass. Both an increase in visceral fat and a relative lack of gluteal muscle mass are independently associated with a higher risk of cardiovascular disease. Follow these steps to calculate waist-to-hip ratio. Place a measuring tape around your waist at the narrowest point, which is typically just around your belly button. Record your waist circumference measurement. Wrap the measuring tape around your hips at the widest part and record your hip circumference measurement. Divide your waist circumference by your hip circumference to calculate your waist-to-hip ratio. According to the World Health Organization, a waist-to-hip ratio of 0.90 in men and 0.85 in women, at minimum, indicates abdominal obesity. If your ratio is higher than 1.0, regardless of sex, your risk of health problems related to abdominal obesity is significantly higher. Sitting to rising test. A sit-to-a-standing test can be a good way to figure out how healthy you are, and it can even predict how long you will live. You should be able to transition from upright to sitting on the ground, and back to a standing position without using your hands. Successful completion of this test requires a combination of cardiovascular fitness, good balance, agility, core stability, flexibility, and leg strength. A study has revealed that the sitting to rising test, SRT, score is a reliable indicator of mortality risk in people between the ages of 51 and 80. According to the study, those with lower scores on the SRT were 7 times more likely to die within 6 years. Here are the steps. Begin with a standing position and allocate yourself 10 points. Proceed to sit on the floor cross-legged. Return to a standing position. Deduct 1 point for every instance of utilizing your hand, knee, forearm, or the side of your leg to assist you in the process. An unaided transition from sitting to standing position earns a perfect score of 10. On the other hand, failure to rise from a seated position results in a score of 0. A score of 8 or more points is the desired outcome. Health tips. The test does not consider injuries. It also ignores joint restrictions. Therefore, if you experience mobility problems, your score might never reach 10. Also, take the test score with a grain of salt if, for instance, you are having back pain, or you had a bad night's sleep. STAIR test. Do you feel out of breath when ascending stairs? The STAIR test is a quick and easy way to determine how healthy your heart is. How fast you take to climb 4 flights or 60 steps of stairs could help indicate good or bad heart health. Depending on how long this takes, it could be time to schedule a doctor's appointment. If it takes you more than 1.5 minutes to ascend 4 flights of stairs, 60 steps, your heart health is not optimal, and it would be a good idea to consult a doctor. If you are able to climb 4 flights of stairs without running or stopping in under a minute, it is an accurate indicator of good cardiac health, and is associated with a low mortality rate. Is your heart in danger? Check with this simple thumb movement. A quick and easy test involving your thumb and palm can help predict your risk of a hidden aortic aneurysm, a major heart issue. Identifying individuals with aneurysm disease before a rupture occurs is a significant challenge. Therefore, promoting awareness of this test could help identify asymptomatic aneurysm carriers and potentially save lives. To perform the test, hold up one hand, keep your palm flat, and flex your thumb across your palm. If your thumb extends beyond the edge of your palm, you may be at a higher risk of a hidden aortic aneurysm. However, a positive result does not necessarily mean an imminent risk of an aneurysm. It's worth noting that the condition may take several decades to progress to a life-threatening rupture. This test simply indicates excessive long bones and lax joints, which could be signs of connective tissue disease throughout the body, including the aorta. Aortic aneurysms are a critical concern, and rank as the 13th leading cause of death in the United States, claiming over 10,000 lives of all ages annually. However, researchers suggest that early detection can increase patient safety through regular monitoring, reduced physical activity, or corrective surgery. Keep an eye on your heart rate. Monitoring your heart rate is essential for assessing your heart's health, and it's easy to do so. To check your pulse at home, place your index and middle fingers on your left wrist below the thumb, count the number of beats for 10 seconds, then multiply it by 6 to determine the beats per minute. An easier way is to use a fitness tracker or a heart rate monitor. A normal heart rate should fall between 60 and 100 beats per minute. If your heart rate is outside this range, seek medical advice. Aerobic exercises to test cardiac fitness. Engaging in aerobic exercises is a way to assess your heart health, although it may not provide highly precise measurements like STAIR tests or heart rate monitoring. If you experience shortness of breath during light aerobic exercises, it could be a sign of an underlying heart condition. Similarly, feeling fatigued and tired after such exercises may indicate insufficient oxygen reaching your muscles through your bloodstream. How blood type impacts heart health. 2 large prospective cohort studies of health professionals with over 20 years of follow-up were conducted to examine the correlation between the ABO blood group and the risk of coronary heart disease, CHD. The results indicate that individuals with blood types A, B, or AB have a significantly greater risk of developing CHD compared to those with blood group O. Blood group AB was associated with the highest risk, followed by groups B and A. This association was not significantly altered by other known risk factors for CHD. The studies proposed that higher plasma levels of the factor VIII von Willebrand factor complex and inflammatory markers in non-O individuals might explain the potential mechanisms behind this association. The correlation between the ABO blood group and CHD risk remained consistent across different age groups. Physical activity levels, alcohol consumption, smoking status, diabetes history, and menopausal status in both men and women. However, in overweight and obese women with BMI 25, non-O blood types A, B, and AB had a stronger relationship with CHD risk than the O blood group. There was no significant interaction between ABO blood type and BMI in men. Conversely, there was no association found between Rh type, positive or negative blood type, and CHD risk. It is sensible to suggest that individuals with blood types A, B, or AB should be aware of their heightened risk and take steps to manage other risk factors, such as high blood pressure or cholesterol levels. 1-minute activity to check your heart health. This quick and simple test is one of the best indicators for fitness and cardiovascular function. However, if you have an active heart problem, please refrain from attempting this test on your own. To start, count your resting pulse rate as a baseline. Say it is 74 beats per minute. You can do it manually or better use a heart rate monitor or fitness tracker. Then do 1-minute high-intensity hardcore full-body workout or alternatively, run on the treadmill for 1 minute at 70 to 80% of your total capacity. Your pulse rate is going to go up due to the activation of the sympathetic or stress adaptation system. Record your pulse at the very end of that 1-minute workout. Let us say it goes up to 150 beats per minute. This gives you the peak pulse rate or PPR. Then wait for 1 minute. The pulse rate will go down under the influence of the parasympathetic or recovery system. Now retake the pulse rate. Let's say it went down to 125 beats per minute. This is your recovery pulse rate or RPR. Now subtract RPR from PPR to calculate how much the heart rate came down in 1 minute. In this example, it would be 150 minus 125 is equal to 25. Now the next is how you will interpret the results. First category. If the difference is less than 12 beats, your heart is at risk. It is an indication that the parasympathetic or recovery system is weak and you have a higher risk of heart problems. Second category. Between 13 and 20 is kind of a gray zone. This indicates a moderate risk. Third category. If the difference is between 21 and 40, your heart is responding normally. Now it's time for a fun teaser activity. See if you can say, upper roll, lower roll, 10 times in a row without stumbling. Let me know in the comments how many times you were able to successfully say this tongue twister. Thanks for watching.